Every day, emergency rooms across the country see injuries and tragedies that could have been prevented. UK Healthcare emergency medicine specialists Dr. Tom Attay and Dr. Blake Davidson are among the doctors on the front lines in these cases. In this segment from a recent podcast, they share some practical tips for keeping your family safe and avoiding a trip to the ER.
Dr. Davidson, what preventable injuries do you see more on the adult side, would you say?
I think the biggest thing that causes the most harm or the most injury, especially around this time of the year, you got spring cleaning activities, is ladder safety. Anytime that you're going to be on an elevated surface, you probably want to be around someone else to be able to help you. So, if you're doing anything around the gutters or on the roof or changing light bulbs that require a ladder, please have someone else around you and do not get onto the top step of the ladder and be unsafe. There are many injuries that I see from those where people try and do something on their own. They're in an awkward position. They fall off the ladder and end up with a bad spinal injury for the rest of their life.
The one thing that I wish every parent would know is safe sleep. Now, granted, this doesn't count the number of kids that we see in the emergency department that end up going into other places in the hospital, like the operating room and the ICU, that end up dying. But truly, the kids that come into the ER and die that could be prevented are truly because they are not following safe sleep patterns. When you may have heard about the Back to Sleep initiative from the American Association of Pediatrics, so the ABCs of safe sleep. Babies should be alone on their back in their own crib. And now this is a little bit controversial because there's a lot of people out there, especially if you talk to influencers and stuff, that talk about bonding with your child and co-sleeping and how important that is for developing the bond between the patient and between the child and the family. But it is not just my opinion. It is the opinion of the American Association of Pediatrics that the best way to protect your children is by following the ABCs. When you think about what these things are, your child should always sleep alone in their crib or their bassinet, not in your bed, not in a chair, not on the sofa. The crib should be boring. There's no blankets, no pillows, no bumper pads, no stuffed animals or toys. They should be on their back. And it is okay to have them in your room, but they should not be in your bed. If they are in your bed, it increases the risk of SIDS, sudden infant death syndrome, by 2.7 to 10 times. You are 10 times more likely to die of SIDS if you sleep with your mother or father than if you were sleeping in your own bed. 70% of SIDS cases occur during bed sharing. And when you look at the studies, there's about 1,000 infant deaths in the meta-analyses, and 90% of them had at least one of these unsafe sleep risk factors. And so when you ask me as a pediatric emergency medicine doc, what are the absolute important things that all parents need to know? It is buckle your kid into a car seat and sleep well.
Explore our library of podcasts featuring UK healthcare experts. Search UK Healthcast in your favorite podcast app.